Joining us today is Helen Fithall, Manager Ambulatory Continuing Care and Allied Health at Austin Health, who will be speaking at IIR's Reducing Hospital Readmissions and Discharge Planning Conference on the 26th to 27th of July in Melbourne. Good day to you, Helen. How are you going?
Good, thanks.
First of all, what are your thoughts on the current status of unnecessary emergency department visits?
Well, I feel that's still occurring, but to some degree we have been able to address those patients who have had some unnecessary presentations to hospital from residential care facilities. So I think to some degree it's still occurring. The access to primary health care is not 24/7, so often we do have some people that still attend our emergency departments that probably could be diverted to other services, but as far as the residential aged care patients go, we're targeting that group to stop unnecessary admissions.
And how does the residential outreach service work in preventing unnecessary visits to the emergency departments?
Well, we have a residential outreach nurse who is experienced in assessment, and she assesses patients with an emergency doctor. One of the physicians, a senior physician, will go with that person to the residential aged care facility rather than transporting that patient in and then fixing what needs to be fixed at that time, but also transporting them back usually that night. This also has links. Also, we have a community link permission go out as well, so that if there's other services that need to be put into the residential aged care facility that will help prevent an admission, then they're also put into that service.
What have been the programme's major challenges and key successes?
Well, probably communication has been a challenge because this involves not only the aged care facility and the patient and their families, but also involves the patient's own GP. We're not trying to replace what the patient's own GP does. What we're trying to do is support that GP when the patient's condition either may deteriorate or needs further investigation, and the only other option has been to send them into the emergency department. That's been a challenge, so that we are communicating the information and that we maintain the continuum of care. The other challenge has also been in education within the residential aged care facilities. Some services have asked for education, others don't feel that they need that, which is fine, and it's education about our service. Otherwise, we believe that it has been really quite successful due to easy access, and that the communication over time has really improved. High satisfaction from both the patient and their families, and our local GPs have also participated in a satisfaction survey. We've also worked with the Ambulance Victoria, who can also at times divert certain patients to our service rather than immediately placing them in the back of an ambulance.
You're speaking at IIR's Reducing Hospital Readmissions and Discharge Planning Conference, 26th to 27th of July in Melbourne. What will be the focus of your presentation?
Well, the focus of the presentation, as discussed, was very much looking at describing how the service developed, some of the challenges and barriers, as you alluded to, that we faced at that time, and how we overcame those, both from our end and also from the residential aged care facilities end. Also, I'm going to discuss the service evaluation. It's now 2 years old, and we've done an extensive service evaluation and had an external audit, and I will discuss those outcomes and what we've actually implemented from the outcomes. And the last part of that, I'm going to discuss 2 years later where to now after we've reviewed this service. Where do we feel that we're going to be placed in 5 years?
Do you think events like this are important for the health sector?
Yes, events like this, yes, definitely. If we can share our experiences, I think we can all learn from each other, so I do think they are valuable.
Helen Fithall, thank you very much for your time.